This podcast is also part of a pod course, which is available for credit on speechtherapypd.com. All you need to do is register for the course, complete the requirements, and you will receive credit. Speechtherapypd.com is a video continuing education company, a certified ASHA CE provider.
Hi, folks, and welcome to First Bite, Fed, Fun, and Functional. I'm your host on this nerd venture, Michelle Dawson, MSCCC SLP, the All Things Peds SLP. This podcast was, like most creative processes, birthed from a combination of several cups of coffees and, honestly, even more questions posed by a series of impassioned graduate students that I've had the pleasure of supervising over the last several years. First Bite's mission? It's to answer those questions that we've all had, but we've either been too afraid to ask or we didn't have the subject matter expert saved to our own personal speed dials. So, do you too have more questions and answers when it comes to treating your medically complex and fragile pediatric patients? Are you unsure if the signs and symptoms that you're observing are indicative of an allergy, maybe an underlying GI issues, or could they possibly be neurologically driven? How many questions do you really have for that registered dietitian regarding the formulas prescribed and the flow rate through that patient's G-tube? Have you ever been consulted for a quote-unquote difficult latch only to find out that the mother's exclusively breastfeeding, but you've never nursed a little one or worked with the breastfed patient before? And what about functional communication? Are you so over flashcards, but you need advice on how to get started with core vocabulary with a non-speech generating device, or how to find the right fit for a speech generating device? Do you have additional worries about the basic day-to-day running and documentation of your private practice? How do you go about obtaining referrals or even documenting that note so that the insurance company deems it medically necessary? If you answered yes, well, then come join me, Michelle Dawson, for this dynamic podcast presented by SpeechTherapyPD.com. Who am I, you ask? Well, I'm a self-described SLP geek with, as my family says, a touch of the ADD and ADHD. I have a passion for serving the least of these, namely the most complex and involved pediatric patients in their natural environment through my private practice, Heartwood Speech Therapy, in the Columbia, South Carolina metro area. I also have had the pleasure, and currently still am, traveling the country where I lecture on best practices for pediatric dysphagia and functional language acquisition delivered through an early intervention natural environment model. Are you still intrigued? Then come join me as I interview some amazing folks. And don't forget that you can submit questions for a Q&A or interview request topics to me via email at firstbite@speechtherapypd.com or on our Facebook page. And also check out our website. Drop a review. Subscribe to obtain those coveted ASHA CEUs. All right, folks, let's get right to it. All right, well, welcome to First Bite, Fed, Fun, and Functional Resources for the Pediatric Clinician. I'm your host, Michelle Dawson, all things Peds SLP. The topic of today falls in the functional category, with emphasis on clinical supervision. In that light, we have joining us today the one and only Miss Juliana Miller, clinical instructor and director of external clinical practicum at the University of South Carolina. This sweet friend of mine and I have had numerous conversations about what it actually means to be a good clinical supervisor. For a lot of us, we remember the tough emotional and sometimes those ethical dilemmas that we faced as student clinicians. And hopefully that inspired us to pay it forward and positively shape the next generations of pediatric SLPs, OTs, and therapists. Well, times have changed since we were clinician students, and Juliana is here to help us set supervision straight. All right, so Miss Juliana, can you lay it on me and tell me a little bit about you?
Well, I have been in the field for quite a while now. I graduated from Texas Tech Health Sciences Center with my undergrad degree and worked for a year as an SLPA.
Okay.
Then I went on to Baylor for graduate school and graduated from there in 97, end of 96, start of 97. So it's been a while now. I've worked in skilled nursing, rehab hospitals. I contracted with schools and with private entities. So there's almost no setting that I haven't been in.
Perfect.
Which has helped me a lot as I've taken this career forward, placing graduate students in clinical practicum sites. So I work for University of South Carolina. I'll try to keep everything I say pretty general, not specific just to us, but just for some background, USC has a on-campus program, a traditional program, and then a distance learning program. So we have students that are local here in South Carolina, and then we have students that live all over the United States. So that helps a lot with kind of knowing what things are of the country.
Okay. All right. Beautiful. So now you and I, this is a long-term process. You and I have talked about this off and on since that article came out in the ASHA Leader about university students feeling intimidated by their clinical supervisors, that they weren't able to voice the concerns. And this is also an outgrowth of the changes that ASHA is coming down through our continuing education requirements. And so this is twofold. How can we make our supervisors better, and how can we build our students up and give them a voice? So can you take me from the university side first and explain what exactly y'all have to go through on your end to place students, and what is being required of the supervisors from a continuing ed perspective?
Sure. So it's pretty challenging for university, and not just with our profession, but really with multiple professions. It's seen with psych, physical therapy, psychology, nursing, that it's just getting harder and harder to get external practicum sites. So supervisors are really, really needed. And not just any supervisor, but really quality supervision, people that really want to help train the next generation of clinicians. It's really, really important. In order for that to happen, you've got to have a site that's willing. So is the administrative staff willing? Is the supervisor willing? There has to be an affiliation agreement in most cases.
Can you enlighten? Sorry, can you explain what the affiliation agreement looks like? Because when I started doing this, I didn't know that that was an actual legal document. So.
Sure. So most medical sites want an affiliation agreement because it really spells out that you are working with a student. And most students are exempt from licensure laws. That's why they're able to, touch a patient even though they aren't licensed to practice. And they're basically practicing under the supervision of whichever person is supervising them. And so it lays out the fact that this is a student. In our case, we provide liability insurance for our students. I think some other schools liability insurance for themselves, but it's just it just lays out what is expected on both sides, and just kind of, indicates this is a student. They're not entitled to, say, employment protections and things like that. They're not going to get paid. It just kind of lays everything out so everyone's on the same page.
Okay.
So once you have willing sites and willing supervisors, then it's, getting the student onboarded. Usually there's, they want copies of liability insurance. They want immunization records, things like that. Every single site and supervisor has different ways that you ask for placements, different ways of onboarding. So it can be challenging for the people like me that might be doing 300 placements a year and have literally hundreds of different people that they can ask, but you have to jump through all different hoops for every single one of those places. So it can be a real challenge at times.
After hearing it from your side, I feel really, really bad for my my placement director and coordinator back at JMU, because I was probably a pistol. So if you're listening, Teresa and Andrea, thank you for putting up with me. And I'm sorry. Okay, so a little bit of honesty embedded in functional. Okay, so we had at our state conference the last 2 years, they have talked about how ASHA is pushing down this new CEU requirement that if you want to continue to be a supervisor, that you have to take a certain amount of continuing education credits.
That's correct. The current requirement is that you have to have Cs and you have to have competency in the area of practice that you plan to supervise in. So in other words, if you're planning on supervising a student working with, say, adults in a medical setting, then you need to be also competent in working with adults in a medical setting. But in 2020, there are some proposed changes, and those are going to be that the super has to have had their Cs for at least 9 months.
Okay.
They have to have 2 hours of professional development in the area of certificate, or 2 hours of supervision in their area of certification. So if they're a speech language pathologist, 2 hours of supervision training. And then, of course, what's not changing is they have to observe at least 25% of the time that with the students that are seeing their patients, at least 25% of the total time with that patient, periodically throughout the whole rotation. So in other words, you couldn't just watch them for the first 25% of their rotation and then never watch them again.
Okay, so that needs to be spread out throughout. Now, I've heard horror stories. I saw the Facebook posting after the ASHA leader of students onboarding for a week and then the clinical supervisor dipping out for the basically rest of the practicum and trying to pass off that, oh, well, I souped them in the beginning. That doesn't count. They have to be there throughout the duration of the 10, 12, 16-week time period. Right?
Correct. Someone with Cs always has to be on site in case they need to be consulted, but 25% does have to take place throughout the practicum. And let's keep in mind that's a bare minimum. So that always has to be adjusted to match the student's capability. So if the student needs more supervision and more support in order to provide the services that are going to fit the needs of the patient or the client or the student in whichever setting you happen to be in, then that has to be provided. That has to be adjusted.
Now, I've heard cases that where the student onboards for a brief period of time and then very quickly thereafter, and this particular incident occurred at like a pediatric outpatient clinic where the clinic started assigning patients individually to that student simultaneously while the supervisor was seeing students, or patients. So it's basically 2 different caseloads, and they were billing off of the student while they were also billing off of the supervisor. And I was confused and taken aback. Is that allowed? Is that a thing? Help.
Well, anything that a student does is under the supervision of their supervisor.
Okay.
So it's there. Every state has different rules about how how students can be integrated into therapy.
Okay.
There are some states that Medicaid won't allow a student to be involved into any degree at all. And Medicare requires that if a student is involved with Part A, the supervisor must be present and running the session 100% of the time. So the rules about how things can be billed vary based on who the pay source is and what the setting is. But if we're talking about just sort of in general, like, can I bill for services that were provided by a student? The student is not billing. It's
Supervisor.
The supervisor is billing. So, the supervisor, it's on the supervisor's responsibility to look up for their particular state and with that particular pay source what the provision for students are. And usually that's going to be in their contract that they have with the entity that they're billing. So the insurance company, their Medicaid, but in general, it's you're dually billing. The supervisor does need to keep in mind that student is working off of their license. So anything that they do that's against the rules could get them in trouble with their own licensure.
So trust but verify.
Trust but verify.
I like that.
Always a good policy.
Mm-hmm. You hear the Navy and Army in my bones. Trust but verify.
It's a really good resource for questions like this. These kind of questions come up all the time.
Okay.
And a really good resource for that is on ASHA. If you just Google ASHA student supervision FAQs, it comes to you can go to this page on ASHA. That's all the questions that people typically ask for in general, for in school settings, for in healthcare settings, where they can find out links to the kinds of answers that they need to find.
Perfect. Okay. Now switch. I went to SHAV, the Speech Hearing Association of Virginia. I was there in March for their 60th anniversary convention. And when I went, there was a supervisor doing a Q&A on supervision at their state association conference. And she was talking about reimbursement, and there is a misunderstanding amongst students. A lot of students think that clinical supervisors are paid to soup them. And I was like, no, but we're not. And one lady said she worked for a pretty large nursing home. I guess they have like contracts in the nursing homes. And she said her company gave them bonuses if they did do supervision, and which I was kind of surprised by. But as a general rule of thumb, supervisors are not paid, correct?
As a general rule, external practicum supervisors are not paid. There are some exceptions to that. There are some universities that say they have a hospital affiliated with their university, and they actually have university staff working in that hospital. So they get a salary as part of their job. In most cases, certainly the people that I'm calling and begging.
I do feel like I remember that conversation.
I would love to give them money, but that's just not an option for most schools. And actually, this past ASHA, we did a survey with several other universities where we kind of pooled our resources and sent out a survey to lots and lots of supervisors, kind of asking stuff like that. And in most cases, the universities that I was talking to, they didn't have a budget for paying supervisors either. I'm aware of at least one skilled nursing staffing company that did decide, not just for speech, but for PT, OT, and speech, that they were going to start charging for students to be able to come. I believe it was $500 for a part-time placement per semester and $1,000 for a full-time placement per semester. And boy, was that an interesting ASHA convention when I was speaking to people with my position. We were all just like, well, there's just no way. So, I mean, that was a big bummer because that was a really, really big and very well run company. But now we can't use them because we don't have the budget for that. For most supervisors, I think most of them are aware that we won't be able to pay them any money. Lots of places, including us, try to provide other things like free CEUs, taking graduate level courses at a reduced rate, things of that nature.
On my end, when I take a student, I do it because I need help. And not in the sense with my patients, but I need other clinicians out there treating the kind of medically fragile and complex patients that I treat. So I view me taking students and molding and shaping and like basically word vomiting nerd facts at them for a semester as an opportunity to have that skill set out there to send patients to. So it's peace of mind because we're aging. I have children. My children will have children. If we don't pay it forward, then who's going to treat us dementia runs in my family. I know I need a speech pathologist in my future, hopefully not for another 40 or 50 years, but it's the paying it forward aspect that means the most, not the other reasons,
Absolutely. It's people like you that make up the bulk of the supervisors that we try to work with. And most of those supervisors do it because they want to pay it forward. Someone did it for them. Because they want to have a relationship with the university, because they want to hear from their students what they're learning in class.
I love picking their brains. What are you learning? Because it's always something. Now, what are the requirements that you look for from supervisors? What are the skills that you're looking for so that this will be a good learning experience for your students?
Mm-hmm. So when I'm doing placements, it's really kind of like a big puzzle for me.
Okay.
We have these students and they have a set of skills and experiences that they have to have in order to meet our department's requirements for graduation. So they've got to have ASHA requires that students have the 375 hours of direct contact practicum. But we actually break that down into a certain number of evaluations with peds, evaluations with adults. You have to show that your students have gotten experience across the Big Nine, across the lifespan, with a variety of socioeconomic statuses and other multicultural experiences, so that they don't come out with just, only schools or only a nursing home. They've got to get a variety of experiences. Sets of skills are laid out by ASHA as requirements. So when I'm looking at a particular student, I'm looking at what types of experiences have they already had and what do we need to build upon in order to, number one, get them what they need to graduate, and number two, have them be a well-rounded clinician, and number three, help them get to where they're trying to go. So once we've gotten their basic requirements out of the way, what do they want to do with their life? Do they want to work with peds? Do they want to work with adults? And what kind of setting do they want to work? Because I really want to help prepare them to be able to walk into their CF on the first day and feel really comfortable with what they're trying to do. So that's how it goes from the student perspective. When I'm talking to somebody who might be a potential supervisor, I'm trying to find out, how long have they been doing this? What kind of caseload do they have? Will there be opportunities for the student to have interprofessional interactions with, say, PT or OT or nursing, or what kind of interactions are they going to have an opportunity to have? What kind of caseload are they going to be working with? And what's that supervisor's teaching style? Because I want to be able to match the supervisor's teaching style with the student's learning style. Because, not all of us are the same, and not all of us work in the same way. And we have supervisors that are kind of hand-holding kind of supervisors. And then we have sort of, this is the way it's going to be. I'm going to quiz you on the floor and ask you problem-solving questions kind of people. And not everyone is going to be the best match for somebody else. So it's really important to have that.
Your poor brain, I hurt for you. Okay. So I've gotten, I've taken up some supervision classes in the last 2 years because, I torture your humans, and I want to make sure that in the process of doing that, I do a better job. And it's different from when I was a grad student. When I was a grad student, you sank or you swam, and you did as you were told, and it was kind of ferocious. The absolute most challenging supervisor that I had made me cry multiple times every single week, but I learned the most from that woman, and she's the reason I became a supervisor, because I wanted to help pay it forward, but do it in a more positive, maybe warm and fuzzy aspect. But one of the things that I took away from all the different classes that I've gone to over the last couple of years is that we have to, as a supervisor, recognize when the feedback that we're delivering to the student is either falling on deaf ears, hurting them emotionally, and we need to recognize where at a baseline our emotional intelligence is and where the student's emotional intelligence is, and kind of make that blend. And I have personally struggled with that in the past. I know you of all people know that, but what are some ways to troubleshoot that, to give feedback to the students to help them grow? But if our verbal feedback is not hitting the mark, what do we need to do on our end?
So I think you brought up a really good point, and that I've heard many say, which is that they hadn't really gotten any specific education about supervising. So they just they tried to either emulate supervisors that they really loved, or tried to not do what they didn't like about some of their supervisors. Okay. And so I think that's really a common thing. And ASHA is addressing that by actually having programs begin to teach about supervision during graduate school.
Oh, I didn't know that.
Yeah, so I think that'll help a lot as students graduate from now on. This took effect this past August 2017. Okay. So students should be graduating now with at least some knowledge of supervision, which I'm kind of excited about. Yeah. And then in addition to that, there will be the continuing ed requirement of the 2 hours once graduated. But so my view on supervision is this, that you've got students that need to learn a certain set of skills. And you know what those skills are because that's what you're grading them on. And so this is really not that different from what we do every day When we have patients or clients or students in a setting, what are we doing? We're looking at that client or that patient, and we're seeing what skills do they have and what skills do they not have, and what do I need to do in order to get them the skills that they need. So that's really not that different when you're working with a student, except for presumably most of the students that you're going to be working with don't have a disorder to work around. Okay. In fact, most of the students that enter programs these days are quite brilliant. That's how they got into a very, very competitive environment for getting into graduate school. So that's what I try to do, is to look at what skills they need and then help them. I like it when supervisors are able to do that in a very formal way. So let's say you're working on, communicating appropriately with a family member as you're making a referral, or talking about how an evaluation came out. And you can tell the student, this is what I'd like to see you do. I'd like to see you do X, Y, Z. I'd like you to introduce yourself, remind them of your role, remind them that you did what the tests were and what they measure and what the results were and things like that. And then afterwards, kind of giving them a feedback sandwich where you do at least one positive thing and then talk about at least one negative thing that they could use to improve upon, and then another positive thing. And then saying, how are we going to do that? How are we going to make this change? And have the student actually problem solve about what they need to do differently, so that when you go in to talk to the next family about the next patient, you really have a set thing that they know they're supposed to be doing when they walk in there.
Okay. So in that light, in your feedback sandwich analogy, mm-hmm. I have seen a significant increase in the students that I've received having, for lack of a better phrase, baseline anxiety disorders, baseline nerves, to the point that I feel as though even when I give positive feedback, they immediately take they take it and run with it and go down a dark, scary corridor. So at what point in time do I, as a clinician, say, okay, there's a breakdown here. What are my options? Can I reach out to you in your role? What do I do to help when it just is going south? And sure. When do I help? When do I seek help, I should say?
Right. So I would love for every single supervisor who is struggling for any reason, whether it's they're having trouble getting onto the program that we use to document clinical training, or whether it's, they have a question about billing, or whether they have a question about, what skills should the student have by now, or any kind of concern like about anxiety or something like that. I would love for them to contact me. Chances are, if you're seeing an issue, we have seen an issue too, and we may have thought that it's all okay and need to know that it's not. It's a tough situation to be in when you're a faculty member, because everything about a student is protected by FERPA. Just as students in an elementary school have FERPA protecting their privacy, those same privacy laws do apply to graduate students in a university. So there's always a limit to.
For people that don't know, FERPA is like patient or student confidentiality, like HIPAA is patient confidentiality.
Correct. so has worked in a school, but FERPA is just the same, is a law that protects the privacy of students, just as HIPAA is the law that protects the privacy of patients.
Okay.
And so, our policy is that if a student is struggling to the point that we don't think they're going to be successful in an outside practicum, we don't send them to practicum. Part of the rules for us is, it's in just about every contract we have, is that if we don't think a student is appropriate for a site, we're not going to send them.
Perfect.
And that's an ethical thing too, is that you always have to have the needs of the patient first and foremost in your mind. And if we don't think that a student is able to provide appropriate services under the supervision of an SLP, then we wouldn't send them in the first place. But we may think everything is fine, and that might not be the case. So it is really, really important for a supervisor, if they think that their student is having a problem, whether it be a clinical preparation thing or an interpersonal thing or anxiety or whatever it happens to be, I would say first thing is to contact the person that set up the practicum so that they can intervene.
And have that channel.
Yeah. So supervisors have a variety of things that they typically ask about. One is what you just asked about, like how do you provide feedback? Sometimes it's how do I have enough time to provide feedback when I've got, a 95% productivity requirement.
That's a real concern from the supervisor's perspective. Like, I want to help that student grow, but I'm swamped. I'm, drowning in paperwork.
Absolutely. So, different schools have different ways of doing paperwork. Quite a few universities are using, and we use it too, a internet-based program called Calypso, which is definitely less time-consuming than the old paper way.
Yes, it is. Thank you.
I don't know about you, but I did not enjoy whipping out the calculator and adding up 15-minute increments of things. I'm not much of a math person, so that was a real blessing to have something that does that. And there's other internet-based documentation programs out there too, but as you kind of get used to them, then they become easier over time. But definitely that can be a concern.
Okay. All right. So I personally don't do a good job of giving written feedback. I have a document staring at me in the corner of my desktop while we're talking that's a working draft on how I can provide written feedback to students. Thank you, Radford University, for that one. And I don't get there. But what I've started doing that seems to yield better results for me is at the beginning of the semester, I take my students for coffee and say, okay, how do you learn? What's your learning style? Help me understand that. And then I make that a priority mental note. I know some other clinicians that I greatly admire and adore and have girl crush on because their brains are wonderful and their souls match it. They do a variation of that. Like their first day, they have them for lunch. If you're a supervisor and you don't have time for that, what's a way that they can build a bridge to seek to understand? Can they contact their students before their first date to drop them an email? Or is that university dependent, or how does that work?
It probably depends on the university, but I would think that in most cases, it's fine to talk with the student beforehand. In our particular case, we have lots of places that want to interview the student before they come. Some of them, they don't even necessarily call it an interview. They just kind of want to have a chance to chat with the student and make sure that what the student thinks they're coming for is what they're actually going to get. and you and I had a conversation like that when you first started taking students, where, your caseload is pretty complex, and you just wanted students to know, they weren't going to be coming in and getting,
100 hours.
That's not what you work on with your kiddos. So, for somebody that really wanted like something that was akin to a school or something like that, like that's not what you provide. And so that wouldn't have been a good match. But there's so many ways to provide feedback and kind of get to know the student that you're working with. And what you mentioned, just sitting down with them and chatting with them about it, is a great way to do that. And over the years, I've had different supervisors who have had, like a little questionnaire, things like that.
Like a get to know you kind of thing.
Mm-hmm. And students, I read this survey once where they asked students and supervisors, they asked the students, well, how much feedback do you want to get? And they had different things they could click on to indicate they wanted that. And of course, they clicked on everything. They wanted feedback, written and oral feedback after every session, at the beginning of the day, at the end of the day, at the beginning of the week, at the end of the week, at the beginning of the semester. It would just be like constant feedback. Whereas supervisors were like, oh, it'd be nice if I could just give them feedback mid-semester and at the end. And that's quite a continuum. Somewhere in the middle is where we need to be. I think that for like a formal evaluation, most supervisors, especially those in external practicum sites where they have 95% productivity, they can't do a formal evaluation of all the things every day or every week even. They don't have enough time to do that, but they can give specific verbal feedback. They might have just like sort of a little cheat sheet where they not jot things down over time. I don't think the students necessarily feel like they have to have written feedback after every session, but they do want to have a sense of, how am I doing? What can I do to improve? And they want more than, that was fine, I'll tell you if you're doing something wrong. They don't want to just not do something wrong. They want to do it right. And they want to have more than one way to get things done. My colleague, Hiram McDade, and he tells this really funny story about how he was a graduate student and his supervisor had told him to do something a certain way, and his patient came in and he proceeded to not do it the way his supervisor had suggested. He did it Hiram's way, and the kid did great. And after the session, he was expecting a big pat on the back, and instead the supervisor was like, "Why didn't you do what I told you to do?" And he said, "Well, because I didn't need to do it that way. The kid was doing great." And the supervisor was like, "Yeah, Hiram's way worked this time. But if you don't learn how to do it my way, what are you going to do when Hiram's way doesn't work?"
Yeah.
You need multiple ways of being able to interact with the child in order to be able to change what you're doing to meet their needs. So I think, every student has opportunities to learn lots of things in lots of ways, and hopefully they can get a variety of ways of getting feedback so that they can do that.
Awesome. Well, all right. So I had a question, and then I got lost in imagining a young Hiram, and he cracks me up, and I love him and Martha. So there goes that question and squirrel. Okay. So, all right. So my takeaway points are from first, thank you. I always sit in awe of all the moving puzzle pieces that you have, because somehow you always manage to send the right student to the right place where they get not just the academic, not just, the bare bones, but you actually do a beautiful job of sculpting them into a clinician. And honey, that's a gift. So hoo-ah for you. You know, I love the girls that you've sent me as I get all misty eyed, and I'm really glad that the people listening can't see that. But practicums are changing. The requirements are changing. ASHA is now requiring students to learn about supervisions while they're students. ASHA is requiring ongoing supervision clinical training effective 2020. So it's 2 hours of training in supervision effective 2020 in order to, and that's 2 hours total out of our out of our 30 hours, correct? Mm-hmm. And then, sorry, folks, 16 is unique to South Carolina, not ASHA. ASHA is the 30. And that we need to, as a supervisor, be dynamic, offer a continuum of feedback, verbal or written, not every 32 seconds and not once a semester, but somewhere in between. And when we have concerns about our students struggling, whether it be thinking on their feet, emotionally, are they prepared? Can they handle this? Or their demeanor, dress code, the basics. We have we have the university, the college to reach out to that person, express these concerns when that feedback directly to the student is breaking down. But yeah,
absolutely. Yeah. I think that, the first line of defense is just to talk to the student themselves about it. And you can just be very honest and say, I see whatever it is you see. I see, taking this really hard, getting teary-eyed. And, some students will tell you, that's just me. I cry at, Hallmark commercials. Like, that's just me having stress, and don't worry about it. And other students that, they're going to break down and say, well, my boyfriend broke up with me, or I've been really struggling in school. I'm afraid I'm going to fail out, or any number of things. Okay. But if you can reach out to that university person, there are so many times when the student contacts me and the supervisor contacts me, and neither knows that that the other has talked to me, and they never will. That I give them both advice, and it's able to get worked out without too much stress. Mm-hmm. But it is important to just kind of be open and honest with the student about what you're seeing, and that you're there to help them, and that you want to help them. And I really appreciate your kind words, but it's not just me. It's really the entire faculty of people that helps students grow and improve over time. And it really does take a village. It takes the whole faculty here or at any university to get an undergraduate student turned into a CF candidate. Mm-hmm. And part of that village is internal leaders, and we wouldn't be able to train our clinicians without people like you who are willing to give their time and their effort to those students. And we really, really appreciate it. On behalf of every single person that's the me at another university, we really, really do appreciate those supervisors that help our students in that way.
So for all of you lovely ladies and gents out there listening, be kind to our students. That they need us to build them up, because that when you and I talked about that first ASHA leader like a year and a half ago, it's our job to pay this forward, build them up, be kind. As a former student once said, build a bridge, build a bridge. Let's give them a bridge.
I have found that, the typical student right now is a millennial, mm-hmm. and millennials get a lot of kind of negative press. Mm-hmm. But and there are definitely intergenerational things that impact people's interaction with each other. But let's remember, like, not everything that we see millennials do has anything to do with when they were born. It has a lot to do with them just being young, and just being young and inexperienced. And a lot of them have never, been in a work situation before, and they just don't know the context sometimes. And, part of being a SLP is being a good communicator. We should be experts in communication if we're an SLP. And so much of everything that happens on site that's a problem can be fixed with good communication. And sometimes they just need the dots drawn really close to each other. But I think for the most part, the students really want to grow and succeed and be what the supervisor wants them to be. And they just maybe need to be shown how.
Okay, so if somebody's listening and they are not currently a supervisor, what do they need to do if maybe we lit a match under somebody and they want to do this? So what's the next step for them?
Sure. So, I have supervisors that contact us and volunteer all the time. And wow, doesn't that make my day? That's great when they do that. Wow, I might as, that's wow. It's wonderful when they do that. The best way to do that is, if you live somewhere locally. I'm trying so hard not to plug my own program right now. So just
no, you can't do that. We have to support.
That's Juliana Miller at USC. If you live close to a program, even within an hour's drive of a program, the people that set up practicum experiences are usually pretty easy to find. Go onto the website for the university, look up communication sciences and disorders. There's usually going to be a page with faculty members, and there's going to be somebody, the clinical education director, something along those lines. If they're not the person that's scheduling practicum, they most likely know who it is and how to get in touch with them. And you can, provide them with your contact information. You'll probably need to provide them with an administrator's contact information so that the affiliation agreement can be drawn up and things like that. But we love to get people that are interested in supervising, and like I said, there's a real need out there,
especially for your distance.
Sometimes it'll be us calling you.
Yes. I'm thinking about that story you told us where you had to get a student a practicum and her island had a volcano erupting on it.
Yeah. Yes. I had a student that lived, we have the distance program. So I had a student that lived on that island in Hawaii that's like having an eruption right now. Yes. That's where she lived. Yeah. And we needed to get her to the other side of the island, and she couldn't drive across the island because that's some kind of nature preserve and you can't drive in it. So she could either go the southern direction or the northern direction, but the southern direction had lava flowing over the road. So northern direction it was.
You for the win, friend. That's like, yeah, I'm not allowed to complain the next ice storm. How about that?
Oh gosh. And it was stuff like that all the time because it's kind of a rural island. We needed for the student to get experience with doing hearing screenings, and that had to be with somebody that had Cs, and there was only one audiologist with Cs that ever came to the island, but they were only there like 3 days a week. It just like went on and on. If you ever see a person that's in charge of setting up practicum experiences for graduate students for pretty much any profession, you should just go up and give them a big hug.
How about instead we buy you a glass of mommy juice? That would work too.
Yes.
Yes.
That works too.
All right, friend. Well, thank you for your time. Thank you for letting me pick your brain.
That's a wrap, folks. Once again, thank you for listening to First Bite, Fed, Fun, and Functional. I am your humble but yet sassy host, Michelle Dawson, the All Things Peds SLP. This podcast is part of a course offered for continuing education through SpeechTherapyPD.com. Please check out the website if you'd like to learn more about CEU opportunities for this episode, as well as the ones that are archived. And as always, remember, feed your mind, feed your soul, be kind, and feed those babies.